As I'd hoped to be. I'd hoped I would confine myself to case histories. For a simple reason. The technical stuff is so open-ended and so prolific that once we get into it, it's easy to get lost on it. I did have an outline for myself. So about what did we say, 1 out of 4? Well, for you people, any other group except here, I think you find my hypothesis is contentious. That is, the hypothesis that coagulation is big news not only relative to validly vascular disease such as myocardial infarct, but actually I'm saying it's important in every, quote, disease. And that treating the treatable aspects of disease, because people come to us docs because we're supposed to find a disease, you know, that's part of the challenge in medicine. And that by treating this eminently treatable aspect of most of the people that enter the domain of clinical medicine, that we're able to do some good in a non-specific way. Let's think of it as a physiological therapy. So that's a take-home message, probably the most important one. That no matter what you or your doctor tells you got, you will also have coagulopathy with it. And the nice thing is that the coagulopathy is easy to treat, cheap to treat, safe to treat, and tends to be very rewarding. Now, it's early in the game.
Coagulopathy.
Can you define that? Yeah, just the fact that blood is coagulating, and it may be, in a practical sense, an advantage to make it coagulate less. In fact, so I don't lose the point, I think that we can divide people into many little pigeonholes, many little where there's one side, this side and that side. You know, there's the good folks and the bad folks, right? The high-minded and the evil folks, and we have all these common every day. The honest ones and the dishonest ones, the ones who are fair, the others who are cheats. I mean, we all have our ways of classifying people. For doctors, there are 2 kinds of people. Well, the big picture. Those who get well and those who don't, all right? And those who get well are the good patients, and those who don't are the bad ones. All right? We know this. We have to confess this right away so you can be comfortable with me. Anything goes. But in addition to that, there are clotters and there are bleeders. And most of the people that come to see doctors are clotters. Now, by what margin is clotting, procoagulant status, a fact in everyday general practice clinical medicine? Because of course it'll vary some by specialty. If you're a hemophilia specialist, you'll have bleeders in your practice. Okay. If you're treating people in a big-time way with the rat poison, the warfarin or Coumadin cure, you may have, just by dint of your lack of sophistication as a physician, you may have an excess of bleeders, because most of the people on Coumadin are over-treated to the extent that they're not only at a hazard for an accidental bleed, but they're also at a hazard almost assuredly for osteoporosis, because the Coumadin not only knocks out prothrombin, but before it knocks out prothrombin, it knocks out vitamin K and the osteogenic so-called carboxyglutamic, or like a different pronunciation, carboxyglutamic residues that are dependent, are more sensitive to vitamin K than is prothrombin. So, but other than that, in the everyday practice of medicine, it's remarkable to find at least 5 out of 6 in my practice are clotters. And the bleeders don't come to me. I think I've figured out already they've got more money and they're spending it at Club Med or on vacations or on charitable contributions or what have you. And the clotters have a different personality type. By and large, after all, Mother Nature's playing games with us, she's decided a significant number, probably half the population are bleeders, and the other half are clotters. I don't really know that this is a fact, but I speculate it must be so. There's advantages to each. Clotters don't bruise as easily, as a rule, as a generalization, but I'll dare to make that generalization in this friendly company. And bleeders, we figure, bruise easily. When you bruise, you get a bruise. It hurts. So people that bruise don't like bruising. People that clot get kind of impervious, thick skin. And there's a different personality type that goes with it. A little more extroverted, a little more precocious. As kids, they're more daring. They're the risk takers. That's what I see. You may know I started out life as, well, my middle life, my middle years from 18 to about 50 were primarily psychiatric. I'm heading for 70 this year, so I consider I'm entitled to a new life. We all go through that sort of thing. We've got our wits about us. We create a new set of challenges for ourselves. And so for me, becoming a real doctor, so to speak, was a midlife challenge. And I would have to say, I probably was not a very good clotter as a youngster, and as I'm getting older, I clot easier. So as a youngster, I tended to be the cautious type. Maybe it's not all on blood clotting. After all, there is a little factor there called the hypothalamus and the amygdala and a few other programmed nervous centers that have a big say on our temperament. But I'm saying that in an additional modifying way, interactive with the rest of your genotype, this element of whether you're a plotter or a bleeder has a personality factor to go with it. Now, way back around being a psychiatrist, that leads a good segue into the fact that way back in the 70s, 30 years ago, it was big news that renal dialysis was significantly beneficial to schizophrenia. A number of people had rapid recovery from schizophrenia just by having a renal dialysis, like the people with kidney failure or people with intoxication. I didn't bring my corroborative data today, so I'll throw it in as this is all by preamble, that these people probably were being defibrinated, that clotting factors, fibrinogen, was being removed with the dialysate. So it makes sense. It didn't have to be. They never did find a schizophrenotoxin. You know, what was the toxic molecule causing schizophrenia? I did bring, however, a reprint. I probably won't find it. It's out of order here. That would bring us into the fact. Well, I can just quote it. But it's nice. You know, it's kind of a security thing. Here it is. You know, proof. I've got the reprint right here in my hand. Hot little sweaty hands. That in spinal fluid in schizophrenia, pre-mortem and post-mortem, I think it's where you find non-neurological injuries, almost zero have CNS fibrin. Schizophrenics running well over 50%. I mean, it's a huge difference. And likewise, a significant portion of the schizophrenic population, according to the statistics that have come out, I don't have the exact statistics, but again, it's up at around 50%, are showing fibrinopeptides, clotting factors, in the spinal fluid. Now that goes the next step further, and we'll get a question on it. The crossover is into fibromyalgia, where we're seeing the same kind of thing, and then we're finding, this takes you back to postpartum depression, where we found spinal fluid vitamin B12 deficiencies way back. Van Tegelen, that was written up by, quoted, I think, it was a Journal of Orthopaedic Medicine way back in the early 70s. That you would find a biochemical defect or a nutrient deficiency in spinal fluid that wouldn't necessarily show up in blood. But here, with what we're seeing now, is that measuring clotting factors in blood as well as spinal fluid, we're finding lots of evidence to indicate that this is a hot subject for clinical research in the first place and for clinical treatment sooner instead of later, just because let the proof speak for itself. You know, if it's going to work, no one will complain. If it doesn't work, at least you tried. So, and it's a harmless approach, as you'll see when we get a step further. A question came up here.
It's not a question, it's a statement.
Okay.
In here, a high-dose fish oil Barry Sears says that high-dose fish oil cures schizophrenia.
Oh yeah, that's well known. Oregon's research. What's not as well known is that both vitamin A and omega-3 fatty acids are anticoagulants. It's interesting. Almost all the antipsychotic agents are also anticoagulants. The tricyclics are all iron chelators, antioxidants. And they are pulling a hydroxyl generator out of the extrapyramidal system.
Where's niacin?
Well, we'll get into all that. The niacin is obviously an anticoagulant, lowers LPA for one thing, but it has multiple other anticoagulant benefits. With the doctor in the back.
I just want to know if one's a clotter or a bleeder.
You want to know which one?
How do you know if you're a clotter or a bleeder?
Well, you have plenty of resources. I'll try to go into a long time to define what would be a sensible workup, because one of the cases I was going to present, I spent at least $4,000 on hemostasis testing. Sounds like a lot until you find he spent about $250,000 so far for his autistic son, medical expenses altogether, not counting the amount that he's donated to Harvard, Yale, USC, Stanford, and other departments to promote research to help his
You said 5 out of 6 of your patients are bleeders, are clotters. How do you know that?
Well, I've now measured 350 people, and they're not perfectly random, of course, but the people that are coming to me, most of them are getting tested. We are running a functional assay for clotting, and I have a slide here, it should be in this pile, right here, that at least you can, this is a terrible slide. I got, Steve will laugh mercifully, I hope, because he hasn't heard from me lately, partly because I've been traveling, and partly because I haven't complied with the entire terms of where we left off last time we discussed things. But last night, in hopes of being able to put together at least the top 10, I figured we could take 10 things here. I went to my copy machine with my materials in hand to copy. Put the first transparency into the machine, pushed the button, and got, for my trouble, a machine jam. I then looked at the machine and I put the wrong type transparency for that machine, and it had all melted, and the entire insides of the machine are now plasticized, probably gone forever. So it's probably simpler to get a new machine. New machine is not a terribly expensive, one of these little $600 or $700 deals, but it's still significant. It could cost $200 to fix it, or what? You see what I'm saying? But so much for making slides. I just am not a good slide maker, and I'm sure I will get into after this PowerPoint and do it like everybody else is supposed to do. Pretty slides on a computer and project it. But let me just put this down. I didn't invent everything here. I think I'm going to do the easy one first, which should. And there's a little knob somewhere. Who wants to focus that? And this is not, don't blame me for this, Phoenix Lab, he makes it Phoenix, isn't that great? Put this together, test for diagnosis of hypercoagulability, and you can see what they're looking for there. It's a terrible slide, you probably can't read it. And if you can't read it, don't worry about it, because this is the technical stuff that most of the doctors have seen all that language before and know what it means. The big picture is when you're testing for coagulability, you can test the thrombophilia. This is hypercoagulability on certain factors that will show up. This will show lack of ability to dissolve clot, hypofibrinolysis. Low fibrin is what clot's made of. Lysis is the dissolving, so you have a lack of ability to dissolve clot. And here you may have some inhibitors that are actively circulating that one way or another throw off the clotting mechanism. Here are binding substances that bind to the blood vessel wall or to the platelets. Here's antibodies to collagen. A big part of collagen, as in the phosphatidylserine, is in the wall of blood vessels. Any trauma will expose it. Even exercise will expose these phosphatidylserine residues. And for some reason, phosphatidylserine is a fundamental activator of clotting through, I think it's factor 12.
Are you saying what is people take
But here
phosphatidylserine?
you got an antibody to it, which should be blocking that, and yet it works in reverse. Nobody knows the answer to that question.
People are taking that to improve their brain function.
Well, I thought of that too.
So what is anti?
Well, that means you got antibodies against phosphatidylserine. So it's a form of lupus. These are called antiphospholipid antibodies. And as I was going to go on to point out, there's a considerable body of clinical evidence that this is the most common cause of fibromyalgia and the most common cause of recurrent spontaneous abortion. The presence of these antiphospholipid markers, which include the lupus anticoagulant, cardiolipin antibody, and antiphosphatidylserine, these are all lumped together as antiphospholipid antibodies. And for some reason, they must be perturbing some sensitive mechanism that makes a decision to clot or not to clot. Nobody can tell it. That's all I can tell you. In fact, one of the reasons I'm kind of disjointed in my own presentation is because I've been waiting for an answer to that question. In fact, I was so mixed up about it, I have not been testing those phospholipid antibodies preferentially. In other words, I didn't believe it. I didn't think that's where it would be. So instead, I've been testing other things. I don't believe, well, here, I've been testing lipoprotein A and homocysteine. In fact, the last time I met with this group, I was hypomanic about homocysteine. But something in the back of my mind said, Dick, there's got to be something more to it than homocysteine. And so I didn't immediately rush to write up homocysteine because I figured I would get a one-sided presentation. And I'm glad I've waited. That was 2 years ago, and in the past 2 years, I've screened over 10,000 abstracts of everything on that page to say, where are they coming from? Prove it. And of course, also to develop a fluency with these factors that are the life and death factors that apply to us all unequally. That is, some of these, like protein A, is a genetic. Homocysteine is genetic. Fibrinogen is genetic. Thrombomodulin is marvelous. Thrombomodulin is actually an anticoagulant under inflammatory conditions. It appears in the urine, and so it's one of the anticoagulant factors. So urine drinkers, here's one in this vein is hardly the word, but in this realm is a plausible rationale for using urine as an emergency treatment for any and every illness. Of course, as we know from Brzezinski's work, it's also got anti-cancer factors and what have you. But we ought not to look askance at the possibility of the thrombomodulin factor, which I'm not going to go into in depth tonight, except for its extent, because I haven't been measuring it, so I haven't looked at it closely enough. But I found it fascinating when I did start going into it. That the first thing I noticed was it shows up in the urine as a marker. Inflammatory process because it's an antidote. There's a lady with a question.
Yeah. Will this information be in your new book? I find this very hard to
I mean, that's one reason. See, I got all this stuff bundled up on my computer by topic. But it turns out there's so many topics. Then I started to review all that. I have yet to finish. I mean, it's overwhelming. It's a full-time job, research, to get that research done. I'm doing about, I would say in the last month, 2 hours to 3 hours a day, just looking over stuff I've already collected. And I couldn't get through all I've collected and already partially assembled. To then evaluate and say, what is there in this that's really convincing? You know what I mean? Where I can say, now here, I'll boil it down to there's 3 reasons why selectin antibodies, 3 reasons why fibrinogen, 3 reasons why soluble fibrinogen, which, it's Isaac Panel, if you want to get but here's the Isaac, immune system activation of coagulation. What that means is when the immune system gets turned on, the blood clots. So infection increases the risk of path of a vasculopathy, meaning heart attack or stroke, by, well, what was it? It was just in the paper the other day, so I'm supposed to know this just like you are. Inflammation. Here, let's not lose this. Let's slide 2 right there, and let's also.
While you're doing that,
Wait, don't let me get lost here. I've got everything arranged, and it's very tight, and I'm already under section 2. It's, yeah, I was remembering 3. It's a 9-fold increase in morbidity. If you have a CRP plus a high cholesterol. So here's a vascular marker, inflammation marker, C-reactive protein. It's called an acute phase protein. You got the flu, you got an infection, you got a boil, you got a bronchitis. C-reactive protein is going to be there. You may not find it when you test for it, but it'll be there. And when the C-reactive protein and cholesterol are both present, your risk of a heart attack is almost 10-fold increase. Oh, that's pretty big news. See, cholesterol by itself didn't do that. But you put C-reactive protein and cholesterol together, and bam. Now, this is a new language. All of a sudden, the American Heart Association, they're no longer just on a low-fat diet. They got something else now just in time, because the low-fat diet flunked.
How about the homocysteine thought?
Well, I've got a lot to say on homocysteine. I've got a whole feature on that, and lipoprotein. I had to pick and choose. What would I talk about?
Are you saying the 2 most important ingredients are cholesterol and C-reactive protein?
They're the 2 most accessible and well-known markers. No, they're not necessarily the best. Nobody knows what the best is. This is so new. Come on, when I started into this, it changed my paradigm of how I was thinking about what it is to be a doctor about 5 years ago. And I started talking about coagulation. I didn't believe it myself, and when I talked to others, nobody believed me. And when I did my work, I was doing work with autistic children at the time, and out of the first 12 that I tested for homocysteine, I had 7 hits in children. Now since then, I just went over my more recent cases where I've done the whole Isaac panel, and on 23 children, we had, let's see, 7 who had fewer than 2 markers, in other words, negative, and 16 who were procoagulant. This is children, mind you. Young people under age 25. I mean, 2 were up in the 20s. Everybody else was under 10.
And therefore, with heart.
Well, where I could say it was plausible then to construct a theory of autism. And the theory was that there is a multiplicity of risk agents in modern life that beleaguer prenatal and neonatal life. So the children are at high risk if they have a clotting genotype, which is what I'm picking up here. If they got a clotting genotype, they're going to be at increased risk during the pregnancy due to everything from brominated diphenyls, the flame retardants that are present in quote that the mother is getting into her system, and it's going to be in the breast milk, it's going to be when the baby is born, in the sheets, in the carpets, Scotchgard. They recently pulled this stuff out of Scotchgard. They're finding it in everybody. They're finding it at the North Pole, Scotchgard. In case you didn't know it, it's the same substances. These are PCB lookalikes. So who's to say that it's not affecting I'm not trying to say that I can prove it is. I'm saying you can't prove it isn't, and there's considerable evidence to indicate neurotoxic effects of that class. Well, let me go a step further. How can we rule out MTBE, which has been hanging around for about the same time as autism is increasing? How can we rule out fluoridation, which has been on a public health crescendo since the 1980s? How can we rule out the fact that the vaccines that babies are getting, up to about 20 of them, are laced, all of them, with not only mercury at a toxic dose, but also aluminum. And the combination of mercury and aluminum is more toxic than either alone. And both are clotters. You put them both together with this genotype stuff that I'm seeing, and you can say, well, maybe we are getting autism selecting out, in part, the clotters. And then, of course, just to make to sweeten the deal the next step further, what's happening on day 1 of every baby now? And no one's being told about this one. They're all being given vitamin K. You know that, don't you? And it's not a little. They're getting a mega dose of vitamin K on day 1. Well, the public health people decided that babies should not bleed. Now, I ask you, maybe you didn't know, prothrombin is very low in newborn babies. Anybody here that didn't know that?
All of us.
In other words, Mother Nature has created a master plan that babies that have gone through the birth canal shouldn't clot. Because presumably the anoxia and ischemia of birth and the trauma of the molding process would leave them with inflammatory after effects. And if they were clotting at birth, and if inflammation and hypoxia induce clotting, which they do, you would have cerebral palsy and mental retardation up the gazoo, socially speaking. So we're not satisfied with that. All babies are given 1 to 2 milligrams, not micrograms, milligrams of vitamin K. Now, to make matters worse, they were giving vitamin K 3, which is menadione. Menadione has no side chains. It's a free radical. It's a carcinogen. And sure enough, by age 5, children that got the menadione versus those who didn't, and there was a statistically significant double risk of cancer by age 5. So this very same culprit, vitamin K, is already a proven devil. And no, that's not even on the table yet. That's my little brainchild, having had gone through all this clotting stuff. And here's the procoagulant hypothesis, and that's kind of like the wild card for sure. So all this, it's a whole new ballgame. We have developmental disorders. And then you realize that with the vaccine disorder, just to sum this up quickly, you don't have a single hit causing autism or ADD, because they're on the same continuum. You have multiple hits, probably prenatal problems, placental problems for sure, because we now know clotting in the placenta is causing the recurrent spontaneous abortions. And where the clotting is concerned, you're getting altered products going into the developing fetus. And it's not just a matter of ischemia, secondary perturbations of the developmental process in its most vulnerable time, particularly 3rd trimester, because that's where the neurological part is particularly at risk. And then we know that at birth, that first hit with hepatitis vaccine, a live virus, a neurotropic virus, and then we know pertussis vaccine, DPT, proven long since. I've got billions of dollars in reparations being paid to families to tend these little babies who've been obviously damaged by the miscarriage of the pertussis vaccine, which, by the way, pertussis toxin is a G protein activator, which is exactly what fluoride is, and it's exactly what fluoride with aluminum is. Aluminum fluoride is used in the neurobiology laboratories as a specific probe to activate G proteins. When you activate the G proteins non-specifically, what you get is non-specific activation, which is exactly what happens in the developmental process of the infant. The infant is activating specific systems in a sequence dictated by Mother Nature. It just happens at 15 to 25 months, roughly that area, the speech centers are developing. And that's why it's tragic to throw the MMR vaccine, where the measles seems to be specifically bad news, but probably the German measles, the rubella, is also a risk factor. And so what can I tell you? I've got one case that I can remember off the top. Lost speech. Already had speech at 15 months. Got the vaccine. Lost speech. Mother was a hero. Treated that baby. Brought it back. Age 4. It's going into regular kindergarten. Speech is returned. They insist the child be revaccinated. Do you want to know what comes next? Because you already could guess. The child lost speech permanently. And there's your multiple hit. Because what you're inducing, this is called the coagulopathy, inducing a loss of blood flow, inducing apoptotic response. That is to say, you get to a critical level of altered cell nutrition. Nobody knows exactly what it all is, but ultimately, caspase enzymes, these are serine proteases. They break down the internal mechanisms of the cell, and the cell is dissolved. It's neat, because it's a non-inflammatory loss of cell. Silent cell death doesn't even invite the macrophages. The cell just disappears. And that's why it's taken so long to get wise to it. I've got something to say on that. But you can see, I'm bringing it back to ground zero here, the developmental cycle. But actually, hey, who here is under age 10? So admit it, you all really secretly want to know how this applies to you. You bet. Me too. I'll tell you, my brother, 7 years older than me, just had a stroke. And he was already treated with all this stuff. He doesn't listen to me so much anymore. He had the misfortune that he got me too soon. He got me when I was vitamin doc, not a bloody hematology doc. So, it's common knowledge now, isn't it? Inflammation increases heart attack risk almost tenfold. Wow. And you can measure C-reactive protein, cholesterol. Okay.
Small question.
Go ahead.
A lot of people, and I'm included, take something like 100 milligrams of aspirin a day. Does this have any bearing on what you've been saying? Or
Well, of course, when you do the aspirin, it doesn't show on this slide. I think it shows on the next one. This is somebody else's slide. My own will be better, but I had to grab something just, shift your visual and auditories and keep you awake. Although, it's very exciting, just even if you pick up a thought here. Wow, look at all these secrets that are right under our nose. I mean, as doctors, right? I mean, even if I'm wrong, you're entitled to be wrong with a hypothesis, If I got you thinking, we're doing pretty good here. Because one guy is never, ever going to get this message across. These are heroic messages. I knew about this, like I was saying, 20 years ago. I didn't believe it. Dialysis, poppycock. And I heard about the clotting stuff. Nah, it couldn't be. I was studying heparin in the 1970s. My first case, wouldn't you know, I gave him heparin for something, for allergies. And he bled. He had a hematoma from his hip where he was injecting sub-Q all the way down to his ankle. That scared the hell out of me. Enough of heparin. That's why it set me back 20 years.
What do you use instead of that?
Well, I'm using heparin.
That just happened to me with heparin, and my leg went 3 times its normal size from its hip to the ankle.
Okay.
And
let me tell you. All right, let me show you the next slide, and I'll answer that question. Because already, this is the best way to learn. You're getting little pieces. And let me tell you something. That's the way I've learned. Nobody's taught me this stuff. I've just sat here for the last 4 or 5 years, obsessed. Admit it. I'm getting less obsessed now that I'm anticoagulating myself. My brain is working a little better. This is already better. hate to admit it. But here we're dealing with, I think we can make sense out of this, even if you can't. I'll boil it down. Yeah, darn it, he has to do it. What he's showing you here is pathogens here and various illnesses. And then he's showing even some therapies. I got one person at transfer factor got worse. Have you ever seen anybody do worse on transfer factor? In fact, with one of the masters of the transfer factor therapy, I won't mention who. It was not just, it was the real thing, in other words. Immune activation. Here are your anti-beta 2 glycoprotein antibodies which bind to platelet surface receptors. Endothelial cells. He's showing virus activating bone marrow and endothelial cells, and then he's measuring it. This is the Hemix lab again, and as fibrinogen, soluble fibrinogen, it's an abbreviation. So you get fibrinogen. That's something that's circulating in your body. It's an inactive form of clot, and it requires an activation state, a catalyst called thrombin. But even the thrombin is so dangerous and has so many other actions that it's in an inactive form called prothrombin. So it starts, layer on layer. Well, you can rebel as a student and say, that's too complicated. I don't want to know all that stuff. But just take away this message. If it weren't this complicated, this is like, we should have a system active for the atomic bomb, right? We just got, the red line. Hey, we just sent a missile over, try to get it over the North Pole. But here, you've got prothrombin has to activate the thrombin. Thrombin then has to take fibrinogen and activate it to fibrin. And that very simple thing, that's what it's all about in order to get clot, thrombus. The clot is called a thrombus. See, that's using the old, I guess, Latin language for it. But we're picking up the subtle stuff, a soluble thrombus that should be, because the blood is constantly clotting and unclotting. See, that's, can you feature that? Yin and yang, inside your blood. If you just clot, you're dead. It's got a name, disseminated intravascular coagulation, DIC. And people that get DIC do not do well. Their toes fall off, their organs rot out, and they die. It's a very miserable disease. And if you get them on time, maybe, and you got to do two things. You got to get the infection that usually is there to provoke it, and you got to get the toxins that have come from it that are provoked. They're called the endotoxins. And you've got to anticoagulate like mad, and you got to do it right. You know, what I was looking for here was to show when this is called fragment 1+2. It's a measurable form of prothrombin. If you don't find that activated prothrombin, you're probably not going to do well to use heparin. See, heparin isn't for everybody. And what's happening is it's being used by guess and by golly. Similarly, thrombin, antithrombin complexes. If they're already high and you still have an elevated DIC, if you're seeing signs of widespread clotting on a microscopic level, the soluble fiber monomer, if it's elevated, that's a marker for the fact that you're not clearing the clot out of your blood. And that stuff is going to end up going to the microcirculation. These are small fragments. The kidneys, the small capillaries of the skin, muscle, fibromyalgia, atrophic, right? You see the senile skin where people look old. That's one of the factors. It's not the only one, because you also got the external ultraviolet beaten down on you, and the internal, whether or not you got enough antioxidants. But this, just putting out soluble fiber from clotting somewhere, and poof, your body filters it out through these organs, and hey, including the brain. So if you got soluble fiber, you bet heparin's a great idea, along with enzymes. Bromelain is the safest and the most proven, 50% absorption, pineapple enzyme. But recently, there's good evidence that the Chinese had it right 3,000 years ago. The meek inherit the earth, earthworms. And earthworms digest anything. So you grind them up and you eat them. You absorb the products and they dissolve clots. Poor man's plasminogen or plasmin activator, anti-clotting material. Also, the soybean, fermented soy, contains enzymes that dissolve clot, and maybe will turn out to be. I haven't even realized. Even though I've been doing real medicine for many years now. The fact is, because my MO, board certification is psychiatry, it doesn't look good for me to get. God forbid I should ever make a mistake. See, I'm one of those lucky ones. I haven't made any bad mistakes in, 40 years in San Francisco. But please, don't imitate me. But you have to be super careful. So I have gone very methodically. I've taken 5 years. And I'm using heparin by mouth. I'm not injecting it. And by mouth, it's safer. But if you're ever worried about it, you've got two things to measure. One, full dose heparin, you got to measure platelets. Because there's an allergic reaction where heparin seems to bind to platelets and pull them out of circulation, and all of a sudden, you have a few days there you bleed. Very dangerous. But it doesn't happen, so far as the consultants I've talked to, under 15,000 units a day of heparin. And I'm treating my patients under 6, certainly under 10. I've got one I'll let her get up to 9. She's a PhD quality person, and I've checked out her blood, and I've met her, and it's working clinically, but no more. And that's by mouth, where you don't get perfect absorption. So I'm going by the symptoms. And I think you get the idea. Here's a laboratory test. Costs $450. You don't go into this one lightly. But of all the things you want to know about yourself, in my opinion, as a clinician, the SED rate comes first. The only problem with SED rate is you got to get it read within 2 hours, because otherwise you get a false increase in the SED rate. As the enzymes start leaking out of the cells, they activate plasminogens into plasmin, and the blood starts to thin out. And so you get a SED rate that's greater. The most serious people are the people we're seeing with a SED rate of 0 to 2. They're the real clotters. They've got the annexins and the integrins and the VCAMs and the ICAMs floating on their blood, evidently, turning it into a gel.
So you're looking for a very low SED rate then?
No, well, that's right. If they got a low SED rate, no matter what any other test says, they're in trouble.
What does SED rate mean?
Sedimentation rate means you just pull the blood, put it in a tube, and watch it for an hour. And you get a number. How many millimeters on that standardized
Numbers on that thing. Is that something we could all get quite easily?
Well, I think we should be doing it in the office. I think it's probably a best test. If you're not in the normal range. And it's not one, it's probably a test to do every time a patient comes in your office. You start getting it, because you can miss it. You know, everyone has their good days and their bad days. And wouldn't you know, how often the clinicians, we know, people come to the office, you look at them, they're perfectly well. When they called a week ago to make the appointments, they were sick as a dog. So it's very treacherous, just like kids with ADT. They get in your office, they look like the sweetest kids in the world. They go home, they turn into monsters. So medicine's very tricky for that. There's that artifactual essence in the office. Well, let's finish with you.
Can cod liver oil, cayenne pepper, aspirin, vitamin C do pretty much the same thing that heparin or Kunin does?
Not as reliably. The nice thing about heparin, you know, when I take my heparin at bedtime, I know I'm going to wake up in the morning. And, you know, my mother's brother had his heart attack at 38 and died at 55. And his other brother, the other brother, had a heart attack at 52. And on my program, not knowing what I was doing, but lots of vitamin E and cod liver oil, lived to 82. And I'm just rounding the bend at 70, and I'm not taking anything for granted. Because toxic times, stressful life, and self-experimentation. You know, it all adds up. Nobody knows it all. It's certainly not me. I'm approaching this. I hope you can sense the humility that I'm presenting this with. But at least I've got data. You know, I've got my most recent. I had to go back and take a second look at my autistic kids, and it not only was 7 out of 12. This time it was 16 out of 23 when I broadened the catch a little bit. So I think it's for real. And when I look at my practice at large, I know it's something like 5 out of 6 in the adult population. So it's fun to talk, but I really want to give you hard data, because my talk is maybe too enthusiastic, you know, and maybe even too hoarse. I haven't cured all my allergies yet, you know. But you should know, I mean, I am definitely my best patient. No question. First of all, I look good and feel good at 70. Secondly, I was a sick cookie for 12 years as a young man due to mercury poisoning. Wiped out. Headache every day, all day, 12 years. Honestly. I've never met a patient that was as bad off as me and still able to function, not disabled. And then we find I've got a homocysteine gene and a partial LPA. In my practice, I collected 100 cases off the top, and just after I started to do these things, and I found 17 of my patients had both, an elevation of both homocysteine and LPA. Now, about roughly half had one or the other, but 17 had both. And of those who had one or the other, you couldn't tell much to look at them. You know, they had intermittent symptoms, that was about it. But those who had both homocysteine and LPA, which bind together and which magnify their binding to fibrinogen 20-fold, I mean, this is research, it's all out there, and which sets up a secondary blockade of plasminogen so that it magnifies your anti-fibrinolytic. It prevents you from dissolving clot. So if you do clot, you're stuck. Every one of these 17 was identifiable as disabled. They didn't all have the same illness, but when they had an illness, it was disabling. You know, there's lots of us, like me, I'm not disabled, but boy, I was sure miserable, and I'm sure I'm not the only one of them. We've all lived through the toxic post-World War II period where nobody done told us that DDT did have adverse effects, and PCB even worse, and that lead that we were taking for granted, back, right, did you do hair tests back in the 60s and 70s like I did? Average lead, 15 parts per million in the 1970s. They took it out of gasoline and paint in 76. By the 1990s, lead was down in my average patient under 1. Huge. I predicted in 76 we would see crime drop 18 years later. That means 1994. I should have published that because my prediction turned out to be correct. It did drop. Now what you're going to see is crime will go up again in 2004, 2003 because the vaccine casualties are coming out autistic and ADD, and they're suckers for drugs. They become drug addicts. That's their self-treatment. The ones that didn't get rid of them self-treat when they're adolescent years with amphetamines, cocaine, and what have you, and etc. But anyway, it's a fascinating topic. The ramifications are all over the place, and so it's fun. I mean, you know, it's obsessive because it's self-reinforcing to it. If you're a curious type mind, as I am, and I'm sure as everyone in this room is. That's why you're here. This is a smart life group. Now, I'm going to whiz through a few headlines for you. I was going to read you David Berg's. Well, maybe it lights me up. You know, you're a leader here. But if we don't need it, I have one more slide, and here it is, which is one of my favorite slides because clotting by itself is not necessarily bad. What clotting does when it's combined with a vulnerable system. Now in this case, this is a research on a animal brain preparation. And all they're showing here is they could predictably create conditions of ischemia, anoxia, or low blood sugar, aglycemia. And what you see here is the electrical activity of that nerve preparation under those conditions. And what do you see? Well, this part says 15 seconds, 1 minute, 3 minutes, 5, or 12. Which condition knocks out the brain the quickest? Low sugar? Zero sugar in the blood, in the perfusate? That took 15 minutes. So low blood sugar, insulin coma, it ain't exactly good for you, but at least you got a little time to grab your orange juice or your Hershey bar or your plain sugar and save yourself. If you just cut off the windpipe, you got about 1 minute, or actually 3 minutes to your. And by the way, what you're seeing here is a flat EEG. This should be very sobering, because you can get a flat EEG in a brain preparation in a matter of less than 1 minute. In fact, it's positive, it's 15 seconds, but by 1 minute, usually it's 30 to 60 seconds. Just reducing the blood flow. What's happening here is you're still circulating some blood, some oxygen, but not enough to maintain the function of the nerve cells. What do? There's a switch in there. They turn off. See, you're seeing schizophrenia. A rapid turning off of the brain with ischemia. Now, I think I can prove it. I've got a case. Cheryl came to me in 1982. with serious anxiety and delusions. She's an anxiety case, the obvious. Turns out, I measured her cholinesterase. She's a genetic low cholinesterase. Cholinesterase is a survival enzyme for detoxifying external poisons like curare, if you're in the jungles of Brazil, and they give you a blowgun. If you've got a strong system, you can detoxify it. Or if you're a modern Western person, you can be operated on in abdominal surgery. They give you succinylcholine, and they bag breathe you for a while, and you're supposed to recover in 30 minutes. People with a low cholinesterase, and a choline ester. Ester means ability to break a bond. An esterase can break the ester bond. It's a loose bond, an oxygen bond, you just cut right through it. Abdominal surgery remains active. I had one patient, in fact, low levels, which turned out to be caused by the fact that she didn't like bugs. A cesarean, and she didn't breathe for 24 hours, almost died. And I said, well, did anyone tell you that pesticides might be dangerous for you? And the answer was no. So she'd go up to visit their country home in the Napa Valley. And everyone else is playing tennis and swimming, and she's under the covers with a pillow, breathing through a pillow up there to avoid the aerosolized pesticides. Well, anyway, you can see there's a lot to it. In fact, I'm sorry I gave you that case. It was just such a juicy one, I couldn't resist. But she wasn't a specific. Clotting case.
For this West Nile virus, we're likely to get sprayed with malathion.
Well, yeah, that's the cure-all. All right, so now we had, but when I was departing from here, just to make the point that I was giving you the case of the schizophrenic, who also had that low cholinesterase. I mean, just to show you, I got into cholinesterase. It took a case like that to wake me up, and from then on, I began testing cholinesterase on all my patients. And you bet, there's lots of people dangerously low on cholinesterase. There's lots of people you can bet who are in psychoanalysis today or taking tranquilizers who are cholinesterase affected. Well, this gal had the cholinesterase, and I thought, gee, that was my point. I really got something. I figured her out. And so you give her anticholinesterase, or you give her atropine, or you give her things that block acetylcholine, which is the neurotransmitter that is supposed to be regulated by this cholinesterase, but her cholinesterase being weak, the transmitter is not being inactivated, and then she's getting overreactive, over-nervous. But she didn't get well when I treated that. That was way back in the early 80s. So then I took another look, and I said, gee, I wonder if she got homocysteine. And sure enough, we picked up homocysteine, I thought, and I got a consultant. This was way back in 1984. And the consultant I picked is the guy who actually has the patent on the test for homocysteine. And he said, no, that's not bad enough to qualify as homocysteine. Well, I had already been treating her with B12. She was well, she was working. And I kind of got sloppy and lazy, didn't treat her actively enough. She relapsed a few times. Then I said, see, it didn't work. And she has life-threatening experiences as a mental patient on the streets over the next few years. Long about 1994-5, when I got this autism thing going, I started taking another look, did the homocysteine again with better normals and better lab tests, and I was by now much more knowledgeable about it. Sure enough, the homocysteine turned out to be positive. Then secondly, LPA turned out to be out of sight. And then as I was going on, since that last visit here 2 years ago, did the rest of the tests, all these tests that you just saw up there, the Isaac panel, and she had rip-roaring soluble fiber monomers. Everything I tested, she was positive. Then I finally got into good medicine, and I said, well, what's your family history like? Right? 10 years later, I'm confessing how stupid. Everybody in her family dies from strokes and heart attacks, in their 40s and 50s. The family is marked for death. Her father just had a stroke. Her mother's got hypertension. I mean, it's just a vasculopathy family. And so, in her case, the vasculopathy was affecting her brain. Now, maybe because Her initial incident, she was exposed to a chromate working in a Dow Corning factory, and all of her symptoms got worse and she went paranoid. And she had a relapse when she was working for Hertz as a desk girl, and they did construction repairs, and again, the ventilator was shutting in right over her desk and she got carbon monoxide. And relapsed when I had her well. And both times she sustained injuries and was worse off after than before. All right, this gal, I got her onto my bromelains and all these things where you're already, you know, it's straightforward. Ginkgo, garlic, ginger, all the herbs, they're all anticoagulants. The cyclooxygenase inhibitors, you know, you're downing the endothelial inflammation. Furthermore, others of them, particularly the so-called hesperidins, are iron chelators, so they take down inflammation that way. It's quite fascinating to see how ingenious Mother Nature is. But she got better. No question she got better. And she was, by now she's impoverished. Her family would pay to see me twice a year. She's in a mental health facility. She's checked out every month or so. They're giving her medication, but the doses are coming down. Then she started to relapse. In this case, the relapse was induced. There was a bronchitis that afflicted her. So she had a serious, and it turned out, then you look at her history, bronchitis is coming up. Now you check her out, she's got mood, brain, and immune problems showing up. I test her for a gene called methylene tetrahydrofolate reductase, MTHFR. MTHFR, you probably never heard of it. She's positive. Treat her now with a bypass program. In fact, as long as it's not being recorded, I treat her with OLO. You see, a product I designed for this very purpose, to bypass folic acid. And about 1 out of 6 people, maybe 1 out of 5, have this in a recessive form. For them, this is mother's milk. But even this didn't work for her. And about that time, I had it all added up. I said, okay, it's time for heparin. So her mother brought her in on a bad day. She was clearly paranoid, not speaking. And I realized this is a college graduate, lovely, articulate, educated woman. And she's led by the hand, more or less. I got the heparin, drew it up into a syringe, 1,000 units. Not that much. I said, Cheryl, I'm just going to give you this anticoagulant. It might taste a little funny, but it's perfectly safe. She opens her mouth, I squirt. And then I go back and I talk to her mother, because Cheryl isn't talking. And usually her mother doesn't come. Cheryl comes. She takes Bart from way the hell over in the East Bay, and she gets to my office on her own. 5 minutes later, she is smiling. 10 minutes later, she picks up her head and says, I feel more relaxed. 15 minutes later, she's talking to her mother. 20 minutes later, she was well. Now I got this slide up here. She was not a full-blown psychotic. She was in the prodromal stage, where in the past she was in the hospital every time she was like that, within a week. This time, on heparin, 1,000 units twice a day, by mouth, squirt. It costs, for her to get 30,000, let's see, she's 60,000 units of heparin a month, under $10. Pretty cheap, huh? She's now been well for 14 months. She's working. Her medications are going to come down. She's almost off medications. It's an astounding case to have a woman with it. It's not like a placebo effect. I've known this gal 20 years. I have failed for 20 years, okay? That's a once in a lifetime. Well, actually not. I've got a social worker, a lovely woman, hallucinating, auditory hallucinations since 1976. 25-year hallucinator. She had good results way back then with big doses of niacin under one of our colleagues. In fact, you've probably seen this gal, Suzanne J. Lovely woman. And she had done reasonably well with me. She consulted with me about 1980, and I saw her a bit, and she got better. And in fact, she got well. The hallucinations more or less stopped then. Then she went off the program, just human nature. It frittered away. So I didn't see her again until 1998 or 9. And she's an LPA. She's also a wheat allergy. So when she got off wheat and milk, boom, hallucinations dropped. When she got treated for LPA, vitamin C, lysine, iodine, a few things like that, she has no hallucinations. It used to be someone had to drive her into my office. She was a disabled person. She had a high LPA and a marginal homocysteine and high fibrinogen. She had multiple clotting factors, not just one or two, the handful. We control them. She's well. Now she has to bring her husband in. Complete reversal. That she's the healthy one in the family. It's not just these orthomolecular cures. I'm not surprising you. When you hit it right, you get dramatically better results because we are doing physiologically specific treatments. When we're measuring these clotting factors, answer to your question about heparin. Heparin's not for everybody. Supposing heparin can be antithrombic, and heparin is also antiplatelet, but there is a place, I suppose, vitamin E megadose is antithrombotic, as well as an endothelial cell normalizer. Probably the king of all the endothelial system, the blood vessel wall, is arginine, which normalizes the nitric oxide system and restores vasodilatation. The omega-3s get in here because we know the omega-6 fatty acids end in arachidonic acid. And arachidonic, this is where a lot of confusion in the medical minds. The arachidonic acid is in the platelet, generates thromboxane, which is a vasoconstrictor. So if your platelets are activated, the blood vessel, to staunch bleeding, the blood vessel will not only get a clot, but you'll get a spasm. That's why these angiograms are so treacherous, because you can easily mistake a localized spasm, which is I think something called Prinzmetal's angina. You can mistake that for a blockage of the coronary artery and say, oh, gee, you got a 95% blockage there. You need to have an angioplasty or a bypass. In fact, one of the cases I was going to bring you, enough for Cheryl, and here's Suzanne. Hallucinations. Somebody with 25 years of auditory hallucinations getting well? Pardon me? I never expected I would see the day. Board-certified psychiatrist, a PhD, I did a PhD track at Stanford in neurophysiology. I've done the basic stuff as well as the clinical. So, whoa. So here's a gal, she had melanoma at age 28. It's now 40 years later. She lived through her melanoma. But melanoma people tend to clot, in case you didn't know it. In fact, whenever you see a melanoma patient, or for that matter, any cancer patient with a fibrinogen over 500, watch out. That's probably the most reliable marker for terminal status, sorry to tell you. And it calls for vigorous anticoagulation methods, which the medical profession at large is just catching on, that the best chemotherapy is heparin. I'd say Coumadin, good, because Coumadin is so easy. The problem with Coumadin is it's a carcinogen. It actually increases the frequency of cancer, but it decreases the amount of cancer death. So you figure that one out. I mean, the statistics are already there to prove that. But in this case, here's a gal who gets 69 years of age, and she's a health maven and a trainer, is getting chest pain, and she doesn't want to go a medical route, but after 6 months and several emergency room visits and equivocal findings, not a real heart attack, they couldn't find the elevated, well, they found some ischemia, but not a classic heart attack, and she wouldn't accept angiograms and that sort of thing. Finally, she said, okay, I'll do an angiogram. So they do an angiogram, and she wakes up with a triple bypass, which she had not agreed to. So she's looking for alternative help, and I bumped into her at one of our orthomolecular meetings a couple of years ago. Well, following the bypass surgery, she developed a pericarditis. It's called a complication. She was well aware of some memory loss. Secondary complication occurs in at least 10%, probably 20% of the cases. And thirdly, after she recovered from these things and was treated with statins and other agents, she noticed that she was getting, whenever she would exercise, she was evidently getting a bypass steal, developing ischemia in the area surrounding the bypassed vessels. You know about that, don't you? The bypassed vessels are larger than the coronaries, so the blood will then flow into the bypass, and it will leave the areas of your heart that maybe aren't too well circulated. So the bypass, paradoxically, is stealing blood from what's left of your heart. And you end up with an arrhythmia with exercise. Well, she was really upset about that. And she turns out to be a high fibrinogen, a high homocysteine, a high LPA, a high soluble fiber monomers. The cutoff for monomers is at 17. Ideally, it would be under 10. She came in at about 30, treated her with heparin, got it down to 10. And with it, her arrhythmia cleared up. Now, this is, for me, a delightful case, because what we have here is somebody who was on their coronary artery morbidity, which I'm not denying. Their coronary artery morbidity was already treated by bypass. And now we treated the bypass with our, what shall we call it? Our blood flow therapy. And with conditioning, and in time, as she develops collateral circulation, I hope she will maintain her heart. Of course, the other thing that happens with bypass, has anyone in this room had a bypass? Because you should know, this is not to be critical of bypass. Hey, you take help, whatever you could get at the time, and we were thankful for it. But we're all also looking for a better way. And the problem with a bypass that is not talked about often enough is that this same thing that she had big time can happen small time, and you get atrophy of the heart that is regional and asymmetrical, and the shape of the heart changes, and the valves buckle. And then you have to go back for a reoperation to put in a stiffer valve. And nobody, it's not fun. No kidding. So anyway, end of speech on that part. I'm just saying, wouldn't it be nice if we could advance this part of medicine? And I think it is happening, where this will become common knowledge, and we'll find more and more people. You won't need heparin. You'll use the earthworm, or you'll use the nattokinase, and I'm headed in that direction. And the enzymes, and the vitamins, and the herbs, and it becomes a whole new pharmacopoeia of practical clinical medicine.
Richard, where does chlorpromazine come in? Why is it good
Chlorpromazine-
and bad?
Well, everything's good and bad, but the chlorpromazine is a well-known chelator of iron, and it binds to neural receptors. So in the brain, it singles out iron in the extrapyramidal system. That's where you get the dyskinesia. But unfortunately, it also chelates out manganese, and so it disrupts the physiology. That the good part then is it alters the activity in these emotional centers that are otherwise so intense. In fact, if you ever see a SPECT scan, do you know what a SPECT scan is? It's like a CAT scan of the brain, but first you give it an injection of sugar tagged with a quick, short-acting isotope. So you can get a picture of the brain. And what you'll see is with schizophrenia, ADD, autism, all these major neurological disorders, frontal lobes are turned off. Ischemia, right? Turns off. Looks bad. Just like the coronary. Looks bad. We got to operate. Don't be so easily fooled. Brain can have a flat EEG and you're still very much able to recover. That flat EEG is Mother Nature protecting her investment. Never trust a flat EEG by itself. That's the point, isn't it? That's what that picture is all about. You can get a flat EEG in 15 seconds. Well, 30 to a minute. And the blood is still flowing, and the cells are just, that's the switch. That's psychosis you're seeing there. That's dementia. There's a lot to this. This is fascinating stuff. Not in the books. You're getting it from me. Take it or leave it. I can't prove it. Those are the thoughts I think when I see that data. Yes, ma'am.
What's your thing, what do you understand about the M valve prolapse or mitral valve prolapse? How do you get that?
Because the shape of the heart changes.
Yeah, but were you born with it?
No. When the shape of the heart changes, the valve is a soft little piece of flesh. It just, if it bends even the least little bit, it'll leak. And when it leaks, then the heart has to start working harder. Pretty soon you're in failure. Can't keep up with it.
They say it has like a lot of symptoms, other symptoms, like anxiety symptoms,
Oh, yeah,
a whole bunch
sure.
of other stuff.
Well, you know, the brain is very smart. It knows when things aren't working. You know, and it doesn't. That's the autonomic nervous system for you. These are automatic functions. The anxiety of a cardiac, well, what do we call it? Failure, or an arrhythmia. Even though you're still not in failure, but even an arrhythmia, as things change, you feel a very decided uneasiness. Even people that never went to medical school kind of know there's something wrong. And there's a lot of that. A lot of emergency room visits that are dismissed as psychosomatic are actually cardiovascular. A lot of it is this ischemia business. The mortality for the people that go to the emergency room and with an undiagnosed coronary artery syndrome is, I think it's 5 to 7-fold increase. I mean, they started depression, the same thing. People with depressive illness. This is not psychological, by and large. I mean, everyone can get depressed, but the kind of depression we're talking about, insomnia. Well, I was going to go and take these further. I departed entirely from my outline by now. Maybe I'll make a closing point and then take questions, because the time is up. So let me just say, as a physician, I mean, I gave you two or three cases. The best of the bunch was an autistic child. You know, I gave you the introduction. The father had spent a couple $100,000. Absolutely a beautiful man. All he had to say to me was 3 words: "It's my son." You know, when you see somebody, you can't help but love somebody like this. His devotion and his sincerity. And his success. We've taken that son, who was a little animal crawling on the floor of my office at 4.5 with no speech to speak of. He could write a little. He could wrote a word or two. And here's a father who's a near genius, or a genius, let's face it. Father's off the charts. And this child is now 11, and he's the top of his class in regular school. But he needed a full, because he had no judgment. See, there's a real damage here. It's not just speech. The dementia that is autism involves speech and lack of socialization is the most obvious part. But behind that also are judgment gaps that make them unreliable. They're accident prone. ADD kids, the same. Very often. Brilliant and stupid at the same time. I'm not that we're all not a little that way, okay? I mean, I don't want to push this too far. But I mean, you get really stupid. You know, like the autistic child that pushed his cousin out of a 10th story window. Remember that one a couple years ago in Chicago? Because he didn't have a concept. Like the little child affected right here, I think I read about the other day, a child fell out of a window. But it was a 2-year-old. The autistic child has about that degree of 1 and 1. It's too late to go into all that. Let me just say that this child did not become liberated from a nurse's aide and a full-time teacher's aide in school, full-time, one-on-one, until I got him on heparin. 2 to 3 months on heparin, and suddenly the child had a spurt about 1.5 years ago that was unbelievable. The school was ready. I mean, everybody noticed that an anticoagulant was the most powerful therapy for this seriously autistic child.
What's your dose on a 4-year-old?
We were doing 500 to 1,000 units sublingual.
Once? How many times a day?
Twice, 3 times a day.
2 times a day.
Totally safe. Listen, heparin is safe for pregnancy. You understand that? It's a treatment for recurrent spontaneous abortion. Totally safe. It's an orthomolecule. All right, now to finish, therefore, I'm an orthomolecular physician. The word orthomolecular, the right molecules. They've held us back terribly for the last 30 years since Pauline, bless his soul, gave us that word. It was a great attention grabber, but also a great provocation. And a better term, I think, for our purposes is health medicine. So I founded the Society for Health Medicine, Orthomolecular. It's our HMO, Health Medicine Orthomolecular. And we do meetings once a year, and this group would be welcome to come to one or more of the days. So we'll see that somebody who gets a copy of that, and Steve, I'm sure you'll know about it, because we're under-attended, and we've decided the grassroots is the way to go. But it should be the right grassroots, people that can really appreciate us. And we're emphasizing more and more a physiological concept, that medicine, we're approaching medicine as physiology, and conventional medicine has been approaching medicine for too long as pathology, disease. We're not pretending to know what's causing all so-called illness, or how to explain all of our patients' complaints. We're fixing what we can fix. And it's easy to fix nutrition, and it's easy to fix circulation. And if you're hip to it, it's not too difficult to fix toxic reactions, because at least just get away from the poison, dummy, you know. And where stress is concerned, there's all kinds of things we can do to de-stress people. That's where psychotherapy comes in, but it's also where endocrinology comes in. What are the stress hormones? Give a guy a break. If intelligently used in a physiological manner, they make a tremendous difference in terms of quality of life and rapidity of response. The judicious use of sex hormones and of corticoids. And growth hormone also. These all have their place. I won't go into today's installment on it because it's a whole different beat. But believe me, out of that 10,000 that I've reviewed, I've got tons of data substantiating this. So our model of orthomolecular medicine, which was nutrition, pollution, and stress, are our guidelines, is now modified so that nutrition equals circulation. In order for the nutrient to count, it has to be circulating adequately enough to reach the cell. And just a little bit of circulation isn't enough. In fact, as far as the brain is concerned, and the heart too, half-assed circulation, ischemia, it's called, is a proven, I didn't give you the data on it, but it's a proven cause of apoptosis, silent cell death. By the time you're in congestive heart failure, you've lost 70% of the cells of your heart. That's why it's hard to recover. By the time you're in kidney failure, you've lost half the cells of your kidneys, or more. By the time you're bald, you've lost half of the hairs on your head, and you hardly notice they were falling out. So, apoptosis is the end-all. From circulation to ischemia to apoptosis to, throughout life, the difference between health and disease. And what we're looking for with this approach is more health, less disease, and a longer, better life. And I think we've got some new tools here. I think you can see at least that, but you can't get the details in 1 hour, but you've got a feeling, I hope, for tremendous results. I mean, I don't have a big enough practice to have 10 of each, but you know, if you in a lifetime, some of these are one-in-a-lifetime cases, why are they all happening this year? I don't think that's placebo effect. I don't think I've suddenly lost my marbles. Okay, take a deep breath. You may applaud if you wish, and then we'll go on to questions. And then I'll take questions. If you don't mind, I'm going to take this young man who's waiting.
You know, just as related to her question, she asked about about the heart atrophying. Is that related to what you said earlier when these people with bypasses, like the bypass vessels, like what happened in Spain?
Bypass is stealing blood from the natural vessels of the heart. The bypass is an abnormal vessel, it's man-made. And no one's calculating in. Like Bob calculated what should be the shape of the cath hip to make a physiological hip replacement. An orthomolecular hip, no doubt. Or no, you see, and here we are, no one is doing that for the blood vessel, for the graft. They're not doing a circulatory dynamic on that. They're just guessing by golly, put in a big vessel, and then what happens is that graft is stealing the blood from all the little vessels. I think they call it the Bernoulli effect, if you know your physics. And the big vessel sucks it right out. Then you have an ischemia in the little vessels, and you get apoptosis big time in that area. And that area then shrinks, silently shrinks. Then the heart goes lopsided, and the valve and twists, and the valve buckles. That's what I'm describing. So here's the paradoxical thing, that in the interest of making better blood flow with a bypass, paradoxically, we're creating the very same ischemia that we were trying to treat in the first place. Wow.
So you have any suggestion when somebody, like they get these tests and the doctors go, oh, you don't have any blood flow, but you're saying that that could be just your body's response.
Well, it's a spasm, you bet.
So how can...
And also, even with a weak program like Ornish is doing, he's able to show reversal, and a reversal of plaque. Now, by the way, plaque is an inducer of tissue factor, which is initiating clotting mechanisms. So I mean, the plaque is dangerous, but treated, it has a chance to resolve. And we'll see in the next 5 or 10 years, mark my word, I'm always right about these things, that we'll see a lot more plaque regression. And so the symptoms count. If we can turn off the ischemia, if we can then prove it with maybe a treadmill study, that we're reversing the ST problems, then I think, or do it with a halter, a monitor program to demonstrate, then we could be long-term, specific to the individual anticoagulation that fits their needs. I think we're going to see a whole new level of sophistication in medical everything. And don't forget, the pancreas is probably the most sensitive organ in the body to this. And how do you diagnose pancreatic disturbance? Well, anytime you have to get up after dinner and let your belt out, or anytime you find out that you're belching more than, or passing flatus more than you used to, that's a pretty good indication that your digestive system isn't the same as it used to be. It may be functional, but it's complaining, guaranteed. And it's time to, well, the pancreas turns off with ischemia immediately. And what are we seeing with these autistic kids? About 2 out of 3 have a verifiable chronic intestinal inflammation and dysbiosis. I mean, bringing that off the wall, I'm telling you maybe more than you can absorb at this late stage, so I'll have mercy. I'll stop on it. Yes, sir.
Heparin with an ulcer.
Heparin promotes healing of the stomach. Healing of the stomach.
It doesn't cause the ulcer to bleed more?
Well, if you got a bleeding ulcer, I suppose you got to watch your step. Maybe you ought to get past that point, but I certainly wouldn't recommend aspirin for someone who's got a bleeding ulcer. But when I've got people, see, we're doing flow cytometry on platelets, and we're actually measuring selectin receptors. The earliest sign of inflammation, actually, is we'll see an increase in the number of attachment sites called CD62 receptors on platelets. When we see that, to me, that's a permission to treat with ginkgo, ginger, and or aspirin. Now, if you've got a bleeder with an ulcer and he's bleeding already, then you maybe better check out their vitamin K, because if they've been taking aspirin, aspirin knocks out your vitamin K. And you get a lot of people with vitamin K deficiency. I measure K now. You wouldn't believe how often it comes up deficient. The neglected vitamin. And vitamin K is another screwball, because when you get too much vitamin K, it has no threat. It's not going to make you clot against your will. But if you have too little vitamin K, you may very well clot against your will. Because vitamin K is essential for both the major 4 clotting factors, I think it's 5, 7, 9, and 11. And I'm wrong on one of those, but 3 out of 4 is pretty good hit. In addition, vitamin K is essential for an anticoagulating factor called protein S. And protein S is essential as a stopgap to prevent runaway clotting. And so what happens when your vitamin K is low, the least little thing, and you'll see it right away. People will show up with what appear to be little, they get purple spots. You see all the old folks with purple spots on their skin. By and large, that's until proved otherwise, vitamin K deficiency.
How much is a good amount to take?
Okay, depends on what the purpose is. For clotting purposes, anything over 200 micrograms will be adequate for the clotting factors. But to get for bone, to prevent osteoporosis and to treat lumbosacral disorders, back pain, you just move yourself to 10 milligrams, 10,000 micrograms of vitamin K, and in a day your pain is gone.
So life extension is 10 milligrams.
Yeah, well, there's the best deal on K so far. It's not, although otherwise get fermented soybean. That's where you get your best vitamin K. The vitamin K from life extension is second rate for bone. That's why you need those big doses. If you get the right stuff, which is K2 and K7, particularly K7, which is present only in the fermented soybean as far as reliable. It's a new ballgame. No, I'm very grateful. I was each year worse with back pain. As I'm getting older, my genotype has started to get the better.
Which soy do you recommend? Is it Jarrow?
Well, I think go to a Japanese market. Natto, N-A-T-T-O. Yes, sir.
Well, I had a fistula done last week, about 10 days ago. You know, the vein.
Fistula for what?
Because I'm to go into dialysis, so...
Oh my, so you have...
Yeah, so I got...
Have you had kidney shutdown?
Yeah, well, it's gotten pretty close to that, so...
Anybody teach you carnitine?
Sorry?
Have you had carnitine?
No.
Lipoic acid?
No. But I had this done, and then, you know, you're just talking about stealing blood from one side, and that's probably what is...
Well, have you had yourself had any experience with renal patients? I've had the longest lived kidney transplant in California as my patient. He did fine as long as he was here in North Carolina. Then he went to Chicago, and they killed it in a year, after 23 years. And they did it with antibiotics, intravenous antibiotics.
You think I did wrong by getting it done?
Oh, no, you got to be protected. Come on. Whatever you did at the time was the best thing you could do at the time.
Right.
But there may be some other options that you should know about. And if you've got any salvageable kidney, don't count it out. Kidneys, I mean, what was the cause of your kidney failure?
Juvenile diabetic, 28 years.
Got any ideas? Is your hypertension along the way with it?
Actually, after this, my blood pressure is way down, and I was surprised because my blood pressure was always high. But after this thing, which was done on the 1st of August, you know, I'm taking the same medication, but my blood pressure is kind of way down.
Well, it may also be that when you're dialyzing, you're getting rid of things. It's like fibrinogen. There's more to it than things you wouldn't normally not be getting rid of. One of the major causes of kidney disease is the pileup of the soluble fiber monomer in the microcirculation of the glomerulus, which then rots out the glomerulus. And you get instead amyloid. And so it's just a long-term thing. And this is exaggerated in the diabetic because at least one thing is glycation. glucose sticks to other things and makes them more pathological. Has anyone measured your homocysteine? It goes up with kidney disease, and it puts you at risk for sudden death from heart attack, unless it's treated. You know, to be my guest, the OLO, this product, you can read about it, is the best product on the market to date. I mean, I designed it to fill a need. Right. For me. Okay, because I'm one of you. And so I'm well aware that this counts. But I'm just, it's, for all that the nephrologists know, they do not pursue their physiology. They took a perfectly viable 30-year-old guy with a 22-year-old, his mother's kidney, and they killed it in 1 year. I'm furious about it. So, obviously, you know. Now, has anyone measured your homocysteine or lipoprotein A?
I don't know.
Because those are the amplifiers of problems. We know already with visual, how are your eyes holding up?
They're doing pretty good. I'm actually amazed that at 28 years of...
Well, the dialysis is great. It will pull out the fibrinogen. You may find yourself getting amazingly better. You may want to do the dialysis no matter what else. But you may also recover some kidney function. So before you count yourself out on that score, look into this aspect of it, and you'll see the things I mentioned. Don't forget, with kidneys not working well, vitamin D doesn't work. Did you know that? If vitamin D doesn't work, all kinds of hormones in your body don't work, and you don't feel good, and your bones will start to rot out. I mean, and it's easy to fix, but you got to be careful. It's got to be done just right, because if you get too much calcium, the calcium will knock out what's left of your kidneys. It's very treacherous. I'm not looking for work, if that's it. No, but nevertheless, the child who came to me at age 12 and was about to go under was kind of karma. And I won't tell you the whole story now for lack of time. In the back.
I'm trying to grasp the gist of your talk, and would you say that for those of us who don't have ADD or these serious conditions you talked about, most of us need to stimulate our coagulating abilities, and how should we do that? Well, the odds are, if you have medical symptoms, it's sufficient to talk to a doctor about it. What if you don't? Well, if you don't, it may be trivial, a moot point. But for most people, this I can tell you. In fact, here, I never even, as usual, I get off track with these talks. I'm afraid, a little bored, and well, I had it sitting right on top. It was a marvelous article on aging and clotting, and it was just so beautifully organized. I thought you might enjoy it. Yeah, so it's very. Here it is. No, it's got to be right on the top. I know it is. Half a dozen clotting factors that increase as a part of the aging process. We become more procoagulant. It's clearly part of Mother Nature's evolutionary plan to have done with us sooner or later. So what should we do about that?
Well, the obvious is learn all you can about healthy blood flow. I bet every doctor here that's hearing me is going to start studying this, take it a lot more seriously, right? Yeah, it's very convincing. I mean, especially the guys that know me, Bob and Carl. We've been together a long time, and they know, like I do, how we would resist something as far-fetched as this, right? It's just too much to ask. I didn't want any new horizons in my life, frankly, at this age. I had enough already. I want to play golf. This one wouldn't let go of me, because the patients were responding so. How can you... So, for us here, there's a number of factors that increase with age. Certainly, the ability to dissolve clot decreases. So enzyme therapy. Talk to your chiropractors. Talk to your acupuncturists. They're all gung-ho on enzymes. What enzyme? Well, the two best known currently available, bromelain and the Japanese enzyme serrapeptase. And both of these absorb well, and both of these enhance fibrinolysis, clot dissolving, safely. So that makes them, you take one in the morning, one at night of either of these.
How about the Wolf enzyme, which combines?
Well, maybe it's okay, it's more expensive, and I just don't quite trust mixtures of enzymes because of autodigestion. One enzyme inactivating the other.
Bromelain, what was the second one?
Serrapeptidase, Serrapeptidase. And then fermented soy products, I think are terrific. For platelets, ginkgo is number one because it has beyond platelet, it's a cyclooxygenase blocker, and if you take ginkgo and ginger, even better. You know, I got Cox and Lux. You know, these are the two major enzyme systems. Are both attenuated safely, not too much. It's not as strong as Vioxx or Celebrex. Good. Let's stay physiological, fellas and gals.
Would you comment on what I consider to be the number one poison, sugar?
Well, it turns out just by taking sugar in excess, C-reactive protein increases. How do you like that one?
Well, I was going to comment, if somebody thinks...
If that's actually been studied...
You know, of all sugar, take with yourself...
Listen to this, Bob. Here, I'll read you, I brought it, this was supposed to be my official talk. Here's the title: Relation between a diet with a high sugar, high glycemic load, and plasma concentrations of C-reactive protein in middle-aged women. So, the prospective data, conclusion, dietary sugar load significantly and positively associated with plasma CRP in healthy middle-aged women, independent of conventional risk factors for ischemic heart disease. And you see, when you take sugar, substitute sugar for C-reactive protein. Sugar plus cholesterol equals tenfold increase in risk. Wow, dynamite. No, maybe it's not going to be tenfold because the C-reactive protein is your gold standard right now, and sugar is indirect, and I haven't read the paper.
Sugar causes inflammation?
Sugar is evidently causing inflammation, probably feeding fungi, and the fungi send out signals to the endothelium that say, clot me baby, clot. And clotting, as you get older, is how Mother Nature's dirty trick. That's how we die. It's very straightforward. And if you want to live longer, I call this bargaining with God, right? We're taking a look which way leads over the cliff, and we're saying, I think I'll take a different road. It's very straightforward, and it'll be increasingly so. You're getting me, I'm an early board, I'm just an ordinary clinician here, studying hard, all mixed up about this, so I can't even follow my script. Because it's, you know, I've got too much in there. And I haven't yet said, this is important, I'm still disjointed. So forgive me for that, but I think you got the idea. I'm very pleased, way in the back.
Don't believe him, he's a buddy genius.
I have a neighbor who has Huntington's chorea.
Yes.
Is there something you said tonight that relates to that?
Well, Huntington is an excitotoxic disorder that affects a thing called NMDA receptor due to a abnormal protein that's been discovered called suitably Huntingtin. It sounds like Rin Tin Tin, Huntingtin. And the antioxidants are the best thing for it so far, plus probably glycine. I haven't had I had a patient, a darling lady, who was going down the tubes 5 or 6 years ago before I knew better. All this stuff that I'm doing now that's new is that, and glutathione is going to turn out to be a godsend. And how to make glutathione happen? Well, there's a number of tricks. Oddly enough, if you want to raise your body's glutathione levels, you go on a low-protein diet. It's a real paradox. Low protein. I can't believe it. Astounding. So
how is that related?
in fact, one of the things I wanted to show you, well, that's all I can tell you. I don't want to take it further, because there is one point I want to leave you with. And that's a study by Chambers and McGregor. And this study is so valuable because it applies to everybody. Here, I got a whole... All this I didn't even touch on for you, okay? So I'm going to bore you just this little bit. Chambers and McGregor did a study in which they loaded people up with protein in the form of methionine. And methionine, they had it as a
So I mean, I got this down to one page, but I'm going to give it to you. The bottom line is about a few sentences. They gave their 17 healthy volunteers, 10 men, 7 women. They measured blood flow in the big artery of the arm, the brachial artery, with the flow site, a flow meter. And they were showing responses to flow based on endothelium, just normal flow, and then also they gave them a drug, like TNT, glycerol trinitrate. They use it for heart angina pectoris. So they use a drug. They had 2 ways of measuring it. And they measured it at, with an ultrasound technique at fasting, 2 hours and 4 hours. And they had 3 conditions. Okay, the one condition was after the protein, the amino acid methionine, which came to about 5 grams a day, which is about the equivalent of 2 steak dinners. And then they also had a second group where they did the same thing again after they gave them vitamin C, 1 gram a day for a week. And then the third, they gave a placebo. So it's a placebo-controlled study. They measured the homocysteine. Now, this group, oddly enough, had a high homocysteine. At rest, they were 12.8, which is already a double risk for heart attack. At 2 hours, it doubled with this load, up to 25. Huge. I haven't seen a 25 all year, you know, just. And these are normal, healthy young people. At 4 hours, it went to 31. I've never had a patient at 31. Okay, so, but they're using an unphysiological protein load. When I do the load in my patients, I do it at a quarter of what they did. I do a physiological load because I'm not interested in somebody that's going to try to set a world record for eating beefsteak. I want to see what happens in real life, so that's how I test my patients. But I'm just trying to show you, even with this huge load, what they found was homocysteine went up, and pre-treatment with vitamin C did not affect the homocysteine. It still went up. Of course, if they took TMG, that would have prevented it. But vitamin C by itself didn't. See, my product has folic acid, B12, B6, acetylcysteine, coenzyme Q, and a gram of TMG. You do 2 or 3 of these a day, you've got a true therapeutic dose of TMG for most everybody. What's TMG?
Trimethylglycine, betaine. It's an oxidation byproduct of choline. Being lighter, being smaller than choline, it absorbs better. And it protects the liver against fatty liver. It's amazing. Also in the liver, it's converted to SAM. You know, if you're depressed, it'll cure depression. It'll triple the amount of S-adenosylmethionine, if you know what that is, SAMe. It'll triple that level. You have to buy SAMe, you just buy this. So it's a half the price. And you get everything else, all the good stuff with it. And
Where do you get that, Doc?
Whole Foods, Real Foods, or pick up a sample. Just anybody just come by, grab a sample, as long as they last. You're welcome, and there's an instruction. If there's a telephone numbers on it. The red stuff is the latest model. The blue stuff is, we're improving.
Whole Foods, all Whole Foods
Oh, it's nationwide. It's a national brand at this point. It's a national brand, by the way, with no advertising. And no publications have picked us up. 0. Which means it's strictly word of mouth. And it's word of mouth because about half the people that take their first dose of this, even if they're on other vitamins, feel better in about 30 minutes. Well, no. You do the fish oil as well. This isn't, I didn't put everything with the kitchen sink in there. This was specific. And what you're hearing here is when you eat protein, homocysteine goes up. And vitamin C does not change that, but the TMG does. And then what you see with the vitamin C changes is that the flow in the blood vessels starts out the same. In 2 hours, without vitamin C, the flow has reduced by 80%. With the vitamin C, the flow is only reduced 25%. The vitamin, so it's dramatic protection from ischemia. The vitamin C protects you in everyday life from the hazards of eating. You know, when you put people on a low food intake,
What do they call that? That's the life extension diet. You'll live longer. Guess what Linus Pauling said? When you take vitamin C, you live 8 years longer. Okay? That's a pretty good payback if you take a vitamin. And that's being corroborated. There are major studies that say, yeah, that's right. There's less morbidity, greater healthy longevity. Well, I thought you'd get a kick out of that, and that's why this product is the only product I know of on the market, because it has to be a liquid product. There's the equivalent of 15 vitamin pills in that packet. So you have to take 15 vitamins to match that one packet. And it tastes good too, and it's going to taste better. We had a breakthrough this week. I've been working for 4 years to get this to come out user friendly.
So when you go to the store, look for the red one. The red one.
Well, the red one, the red one is the current version, and it's quite nice. We got it to be a little bit more fruity. I had originally designed it to be very bland, figuring that everybody would put it in with some juice or something and make it to their favorite. So I made it almost no flavor. Now we've given it a Jim Jones flavor. Yeah, it's got a Kool-Aid. It's got a Kool-Aid taste now. Okay, so brace yourself. But you'll learn to love it. No kidding. I've learned to love it. If you wanted to improve it, you'd throw some mag sulfate or any form of magnesium in also.
Better with food or in your stomach?
You can do it anyway. It's marvelous on an empty stomach.
Sublingually, is that better?
No, just swallow it. It's fully absorbed. It's a liquid.
And at night, does it affect your sleep?
No, you sleep better with it. The TMG is a methyl donor. It methylates histamine, which inactivates histamine. So it turns off the persistent stomach acid that causes dyspepsia. So for most people. Now, nothing's perfect. Occasionally somebody just doesn't like it. Okay, no hard feelings. We have a second product coming out that will be a mineral vitamin K, ginger, and gotu kola. And the gotu kola even further settles the stomach. And that'll be this will be a morning product, that'll be an evening product.
You don't have beta-1,3 glucan in there or anything like that?
I'll tell you, beta-glucan it's a very tricky thing. Again, you're throwing in cysteine, you're throwing in proteins, you're throwing in whey. Don't tell me it doesn't have some lactose in it. And so I'm very careful about secondary symptoms. If you send somebody out to get psyllium seed, one of the finest fibers known to man, and they cut it with lactose, the old Metamucil, lactose. It's just unbelievable what the stupidity of the pharmaceutical industry. Yes?
Pardon me, notice that this has some fructose in it. What about fructose in a small diameter triglycerides?
Well, fructose at 1 gram, I think, is harmless. You've got to remember, if you were going to eat a pear, how many grams of fructose in a pear?
Well, probably about 30 or 40.
No, but let's say 15 to 20.
Okay.
So we're giving you 1. If you went out and got Emergen-C, they've got 4, I think it is, or 5. They got 4 times more than we do.
Okay.
This is the lowest, and it's a natural sugar, which means a familiar taste sensation. If you don't do that, people won't drink it.
Yeah, it didn't say how much fructose, so.
Yeah, so this is currently, of the commercially marketed products, the lowest fructose. There's no aspartame, there's a little stevia in there, but the stevia turns out to be anti-diabetes. So, hey, I'm doing it twice a day. Love it, even if I do say so myself. Yes, my friend,
yes,
James.
Mr. Kunin, Dr. Kunin. I had a question for my neighbor who tried to make it tonight. She had severe mercury poisoning. She didn't realize it. She was raised in San Jose and drinking that water from all the computer companies dumping their mercury in down the pipes. Hewlett-Packard had a schedule. My friend was in charge of that department. He would dump the mercury every hour. You have to check the clock as he dumped the mercury down the drain.
Oh boy.
That was in Hewlett-Packard. That was many years ago, Chris.
And that goes into the ecosystem.
It goes into the aquifers, apparently. And so she had, and all her friends, she said, the whole office, she said, now that they're all 30-something, she said, the doctor's offices were filled with these kids, now in their 30s, getting chelation therapy. And she was given, is it DMPS is the other one, other than EDTA? She got that, and she was just wondering, she said, a lot of her hyperactivity, her depression, her mental problems are gone. She said it's great, except that she feels wasted and drained, and I wondered if the Ololo would be a good way to rebuild the system, and what organs are most affected by chelation therapy, as far as having to rebuild their function.
Well, of course, the problem with chelation therapy is that it's an invasive treatment, where Mother Nature gets rid of mercury slow but sure with, I think, a 7-year half-life. And so, but